List of countries on the EU's non-essential travel list. Its number of confirmed COVID-19 cases has now reached almost 2.6 million and over 126,000 people have died. At least 16 states have slammed the brakes on reopening. Texas and Florida have shut bars, while Kansas and Oregon have made wearing masks in public mandatory. New Jersey has also postponed indoor dining because of people flouting social distancing rules. Well, testifying before a Senate committee on President Trump's coronavirus response, the nation's top health expert, Dr. Anthony Fauci, had words of caution for states.
We've got to make sure that when states start to try and open again, they need to follow the guidelines that have been very carefully laid out with regard to checkpoints. What we saw visually in clips and in photographs of individuals in the community doing an all or none phenomenon, which is dangerous. And by all or none, I mean either be locked down or open up in a way where you see people at bars not wearing masks, not avoiding crowds, not paying attention to physical distancing.
Well, Arizona is one state that has abruptly reversed its course of reopening as cases spike. Well, joining me from Phoenix is Dr. Saskia Popescu, an epidemiologist at the University of Arizona. Hello there to you. Many thanks for joining us on the program. Now, I can only imagine epidemiologists like yourself are relieved that restrictions are being reimposed in Arizona, where you are as well. But given how out of control the situation in the US seems to be when it comes to the spread of COVID-19 and this surge in cases, how long, in your opinion, will lockdowns have to be reimposed?
It really depends. Right now, Arizona's closure of bars and gyms is for 30 days. I think so much of this is going to be dependent on if our efforts for community mask wearing and social distancing are going to be effective. But also, I think the challenge is that each state is in such a different position. So what could last for 30 days in one state might be longer in another, depending on how seriously they take it and how good the communication is to the public in terms of, this is serious, here's what you need to do to help, prevent the spread of this.
Yeah, but Saskia, a top expert from the Center for Disease and Control, has said that cases are spreading too fast in too many places to actually be brought under control. Is the US getting close, or is it at a tipping point, a point of no return?
I think it's very possible. I mean, the hard part is that when we say the point of no return, I worry that people will just give up on their efforts to be safe and to prevent the spread of infectious disease, especially as we're talking about a COVID pandemic that could last well into respiratory virus season, flu season this fall. So my concern is when we say that, people will give up, and I want people to still maintain vigilance, because if we really work hard right now, we can hopefully turn this around in a couple of months, but it's going to be a marathon. It's not a sprint. So when we talk about terms of closures and, reopening efforts, we have to stop thinking about it in terms of weeks and really months to be reasonable and practical in what we're looking at.
But what does it mean in real terms, reaching this point of no return? What does it mean for hospitals? What does it mean for US citizens as they're faced with this rather terrifying prospect?
I think for healthcare, it means that we're not going to be getting a break anytime soon. We really need to make sure we have sustainable efforts to handle large volumes of COVID-19 patients. We have to maintain testing. And for the public, I think a lot of this means, going back to a new normal in terms of masking while out in public, being cognizant of social distancing and large gatherings, because the truth is that this isn't a situation that's going to change soon. And, if we're at the quote unquote point of no return, well, what does our new COVID-19 world look like, and how can we maintain our vigilance and helping it, I should say preventing it from spreading further? So my concern is we have a problem right now, but we need to focus on not making it worse. And right now, healthcare systems and public health systems are so overrun, they're so overstressed, and we need to give them a little bit of a break so that they can get back to their jobs and we can get a handle on this. So that's my concern, especially for the public. Masking isn't going to be a couple of weeks or a couple of months. We need to be looking at this in the long term, at least through the end of this year.
Okay, well, the governor of the state of Arizona has echoed what you're saying and has said the situation will not return to normal anytime soon. How is public opinion, or do you have the public on board when it comes to this? Because we've seen the politicization of wearing masks. We've seen a confused leadership, I guess, when it comes from Donald Trump in terms of the response to COVID-19. So is Arizona on board with this new imposition of restrictions of measures?
I think so. I think people are getting much more on board, especially as Governor Ducey announced yesterday that we really have a lot of work to do to control this. I think, as you mentioned, there's been so much politicization of public health and masking efforts, and that really confuses people, that normalizes behavior we don't want people to engage in, like not masking, like going to a busy bar and not social distancing. So I'm hopeful that as more and more efforts are made from Governor Ducey, from local leaders to reemphasize how serious this is, that will encourage people to, make a shift in their behavior. But overall, I think most people were actually frustrated that it was taking so long for these efforts to go in place. So I think that's hopeful, and that people are recognizing the seriousness of the state of Arizona, and that as we see California and Florida and Texas experiencing very similar events, that we need to take this seriously, and the time for action is now.
Okay, the time for action is now. Well, Dr. Saskia Popescu, many thanks for joining us.